Hello, my name is Ayomi Pipamikole, and I'm here to explain back to you about bed making occupied, which means when the patient is actually on the bed. So once you knock, you come in, you wash your hands, you introduce yourself, you identify the patient, you allow for privacy, and you explain the procedure, what you're gonna do. So if this time around is um, making the bed when the patient is still on the bed. So what you need is the bath blankets, the linens, the fitted sheet, the draw sheet, the cup sheet, and the cup bed spread, and also the pillowcases. You always want to make sure that the pillowcases and all the linens are away from your body. You don't want the linens to get in contact with you. The only things that needs to be touching the linens are your hands. Um, so you bring up both sides of the rails. You bring the bed to your preferred height. That's where your hip is, which is good for better usage so that you don't have any back problems. You take the top covers, um, you take the cuff covers of the loosen them up and take the linens off. You take the top blankets, you fold to the bottom of, if reasonable, take the bath blankets to the patient. So you take the bath blankets and cover the patient and bring out the sheets under the bath blankets, so that you're taking off a linen while using the bath blankets to cover the patient. Now put the sheets covering to the covering the patient with a linen chart. Then take away the dirty linens to the linen cart. So you roll the patient to the side away from your body, because you are trying to remove the bed coverings and the bed sheets and the linens without actually making the patient come out from the bed. So you're gonna roll the patient away from your body to the side of the bed. Now take the linen and roll them inwards to the patient's back, underneath the patient's back. So then after that, you take the bottom sheet and roll it underneath the patient's back. So you take the filtered sheet, and you make sure you state that you filtered the sheet and would hands down. You tuck your fitted sheet around the bed on each corner. You tuck in underneath the dirty linens, and you take the draw sheet. So after when you take the draw sheet, you state that the hems are together and down. Make sure the hems are together and downwards. Open the sheet and then tuck in the rest under the patient, under the mattress. Then once you've tucked in the dirty sheet already, and you've um, put in the clean ones also underneath the patient, you roll the patient back to the clean part, to the clean side of the bed, the one you've already tucked in underneath the patient's back. Then you put the side rolls back up where you were standing. You put the side rolls back up. Then you go to the other side of the bed, and put the side rails downwards to remove the dirty linens from that side part of the bed. Then you take all the dirty, you roll all the dirty linens on the bed and put them in the linen cart. Then you put the clean sheet over and tuck in under the mattress. So you pull the clean the clean linen sheet that was under the patient. You pull it out from the other side, and make sure you tuck it in under the mattress and the bed. You put the side rows back up. Then you open up the sheet used to cover the patient. Now, do not cover the patient face up. You shouldn't cover the patient face. Take the rest of the sheet and tuck it in at the corners of the bed. Pull out the bath blankets out and take the bedspread on top of the sheet. So after putting the bed sheet, you take out the bed bath blanket underneath the bedspread. You open the bed sheet, find the center, and spread it. So when you find the center from the bed sheet after opening it, you make sure you spread it on the patient. And after that, you tuck it down at the bottom. Take the bed and the bedspread and bed sheet and spread it. Raise your side rows back up to go to the other side and take the linens and bedspread and pull it over, tuck in the extra. So once you've laid the bed sheet and the bedspread on the patient, so it's going to be halfway done. So once you've done with that half, you have to go to the other side of the bed and put and you continue and bring the other half to that side and tuck it in and put the side rails back up, and make sure you put the clean pillowcases to the pillow, and you always want to make sure that the pillow doesn't touch you. You put the clean pillowcases into the pillow, and you face the pillow close to where the door is directed. You always want to make sure the pillow, the extra sheet of the pillowcase is facing the door of the room. Now put the side rails back up and lower the bed. Depends on the patient. If the patient requires the side rails to be up, then you put the side rails up. But if the patient doesn't require that, then you put the side rails back down and lower the bed. When you lower the bed to the ground lowest level, you wash your hands. Before you wash your hands, I need to give the patient your call light to call for any emergencies. Then wash your hands, report and record, and that is how you do making bed occupied when a patient is on the bed. I usually do this at my work. I usually help the PCAs. Since I'm still an intern, I used to help the PCAs do this. I used to help the PCAs change the bed when the patient is on. Even when the patient is not on the bed, I always assist and help. So I have an idea of how to change the bed. But I normally help a lot with the PCAs, so I think I know how to do that. Might not be the best explanation here, but I normally practice them at work. So the lessons I'm getting from school and also the teachings from PCAs and nurses at work, I normally put them together and use them when I need to. So I don't really have the equipment, the right linens or bed sheets to use, and I don't really have the right bed to use. So that's why I'm trying my best to explain it to you, to my understanding, and I hope this will be okay for you to grade and everything. And I hope you like the video. Thank you.